Hello, expectant parents. Pregnancy is a time of many changes and questions, especially when it comes to intimacy. One common concern among couples is whether it's safe to have sex during the first trimester of pregnancy. The good news is that, in most cases, sex during pregnancy is perfectly safe. However, there are some considerations and precautions to keep in mind. Let's explore the safety, benefits, and any potential concerns of having sex during the first trimester of pregnancy. Number 1. Is it safe to have sex during the first trimester? For most healthy pregnancies, sex during the first trimester is completely safe. The uterus is well protected by the amniotic fluid, the strong muscles of the uterus, and the mucus plug that seals the cervix, preventing infections. The baby is cushioned and safe, and sexual activity will not harm the developing fetus. However, it's always important to consult with your healthcare provider about your specific situation, especially if you have any complications or concerns. Number 2. Potential benefits of sex during pregnancy. Engaging in sexual activity during pregnancy can have several benefits. Physical intimacy. Maintaining physical intimacy can strengthen the emotional bond between partners, which is especially important during the sometimes stressful journey of pregnancy. Improved mood and reduced stress. Sexual activity can release endorphins, which help improve mood and reduce stress levels. This can be particularly beneficial for pregnant women who may be experiencing anxiety or mood swings due to hormonal changes. Better sleep. The relaxation and release of tension after sex can help improve sleep quality, which can be a challenge during pregnancy. Number 3. Changes in libido. During the first trimester, women may experience a range of changes in their libido due to hormonal fluctuations, nausea, fatigue, and other pregnancy symptoms. Some women may find their sexual desire increases, while others may feel less interested in sex. Both responses are completely normal. Communication with your partner about these changes is key to maintaining a healthy and supportive relationship. Number 4. When to be cautious. While sex is generally safe during pregnancy, there are certain situations where you should exercise caution or avoid it altogether. Always consult your healthcare provider if you experience any of the following: bleeding or spotting. If you experience unexplained bleeding or spotting, your doctor may advise you to avoid sex until the cause is determined. History of preterm labor. If you have a history of preterm labor or other complications, your healthcare provider may recommend abstaining from sex as a precaution. Placenta previa. This condition, where the placenta covers the cervix, can increase the risk of bleeding during sex. Your doctor will provide specific guidelines if you have this condition. Incompetent cervix or cervical insufficiency. If you have a condition where the cervix begins to open prematurely, your healthcare provider may advise against sexual activity to reduce the risk of preterm birth. Infection. If you or your partner have an active infection, it's best to avoid sexual activity until it's treated, as infections can potentially harm the pregnancy. Number 5. Comfort and positioning. As the pregnancy progresses, finding comfortable positions for sex may require some creativity and adaptation. During the first trimester, many women still find traditional positions comfortable, but as the belly grows, you may need to explore different positions to find what works best for you. Communicate openly with your partner about what feels good and comfortable. Common myths and misconceptions. There are many myths about sex during pregnancy. One common misconception is that sex can cause miscarriage, especially in the first trimester. However, in healthy pregnancies, sex does not increase the risk of miscarriage. Miscarriages are usually due to chromosomal abnormalities or other underlying health issues, not sexual activity. Emotional considerations. Pregnancy can be an emotionally complex time, and it's normal for both partners to have varying feelings about sex. Some may feel more connected and intimate, while others might feel anxious or self-conscious about their changing bodies. Open communication and mutual understanding are crucial. If one partner is uncomfortable, it's important to respect their feelings and find other ways to maintain intimacy and connection. Communicating with your healthcare provider. If you have any concerns or questions about sex during pregnancy, don't hesitate to discuss them with your healthcare provider. They can provide guidance tailored to your specific situation and reassure you about any doubts you may have. This is particularly important if you have a high-risk pregnancy or any medical conditions that could be affected by sexual activity. Exploring alternatives to intercourse. If intercourse is uncomfortable or not advisable due to medical reasons, there are many other ways to maintain intimacy and closeness. These can include kissing, cuddling, massage, or other forms of physical affection. The key is to focus on maintaining a strong emotional and physical bond with your partner. Postpartum considerations. While the focus here is on the first trimester, it's worth noting that postpartum sex requires similar consideration and care. After childbirth, it's important to wait until your healthcare provider gives the go-ahead for sexual activity, usually after a postpartum checkup around 6 weeks. This allows time for the body to heal and for any bleeding to stop. In conclusion, for most couples, sex during the first trimester of pregnancy is safe and can be a healthy part of the relationship. It offers numerous benefits, including emotional bonding and stress relief. However, it's important to be aware of any medical conditions or complications that may require caution. Open communication with your partner and healthcare provider is key to navigating this aspect of your pregnancy journey safely and comfortably. Thank you for joining me in discussing this important topic. Remember, every pregnancy is unique, so always prioritize your health and well-being. Stay informed, communicate openly, and enjoy this special time in your life. See you next time.